I've tried to live my life outdoors, whether it's riding my motorcycle, spending time with my sons. It's just where I love to be. But when you have COPD, sometimes your disease gets in the way of things that you want to do. What it felt like is you'd be short of breath. I'd walk from here across the street. It was exhausting. Everything was exhausting. You just lose all sense of self after a while, because all you worry about is what you can still do. I can sit here, wow, or I can get up and walk across the room. There were times when that was a big part of my day, if I could walk across the room. I get so tired that's why I quit riding. So I'd ride somewhere, I'd spend an hour on my scoot, and literally I fell over in a parking lot one day. I was so tired, I couldn't hold up my bike. It was really a sad day. I've been riding since I was 15 years old, and all of a sudden, a couple of old people, older than I am, came over and helped lift up my bike off me. It was kind of comical. But that was when I knew that the motorcycle was over. My family plays an incredible role. My wife has many wives, the rock, the stable part of the house and the family. She's there for most of my doctor appointments. So it's good to have that kind of support. As my COPD's progressed, I've been in and out of the hospital a lot. 2 years ago, I was in at least 8 times for a week each time. I missed a lot of work. A while back, I was in the hospital after a particularly bad event in my parish, and this was a really sweet thing. They made me a prayer quilt. It was something they do for people who are really sick. You get a lot of warm fuzzies when somebody goes out of the way to do something, especially when you're not feeling good. I've been on, I think, just about every med they've ever released for COPD. No matter what I've tried, improvement always seemed hard to maintain. Finding a good doctor was key for me. I've gone through several. The doctor I have right now, she's awesome. It's been a tough case for her. Right now, I'm happy with my doctor, my medications, my schedule. And I really don't want things to change, because I feel better right now, and I believe that LONHALA MAGNAIR is certainly a big part of that.
Individual results may vary. LONHALA MAGNAIR glycopyrrolate inhalation solution is a prescription anticholinergic medicine used long-term and twice each day, morning and evening, to improve symptoms of chronic obstructive pulmonary disease, COPD, in adults with COPD. COPD is a long-term chronic lung disease that includes chronic bronchitis, emphysema, or both. A summary of important information for LONHALA MAGNAIR will be presented at the end of this video.
Beyond that, it's also very portable. Bag's small, it's light, it's comfortable to carry. Just put it on my shoulder and go to work. When I received my first box, there was a video and instructions. It did a good job of going over all the details and how to assemble and use it. It explained that I needed to wash it with clear liquid soap, nothing opaque. Right after I watched the video, I went ahead and cleaned the device, then did my first treatment. It only takes a few minutes and there's barely any noise. My wife, the first time she saw me taking it, she said, "Wow, it's so quiet."
Do not use LONHALA MAGNAIR if you have sudden symptoms of COPD. LONHALA MAGNAIR should not be used as rescue therapy. Always have a rescue inhaler with you to treat sudden symptoms of COPD. If you do not have a rescue inhaler, contact your healthcare provider to have one prescribed.
I work 4 longer days so I can enjoy my Fridays off. I use LONHALA MAGNAIR before work around 5 a.m. Then I'll wash the machine so it can dry. I get dressed, ready to go. I put it in the bag and head to the office later that morning. Around dinner time, I pull open the bag, set it up, and do my second treatment while I read emails. After about 2 or 3 minutes, I'm done. I clean it out, set up to dry, and put it back in the bag before I leave, around 9 p.m.
LONHALA MAGNAIR can cause serious side effects, including sudden shortness of breath immediately after use, Sudden shortness of breath may be life-threatening. Serious allergic reactions, new or worsened eye problems, new or worsened problems emptying your bladder. If you have any of these side effects, stop using LONHALA MAGNAIR and call your healthcare provider or get emergency medical treatment right away before taking another dose.
I'm not climbing Mount Everest, and I won't be doing a lot of physical things probably the rest of my life. But I'm doing more than I could. I'm not fighting for every breath. I've been feeling better, and that's wonderful. I feel in my heart that LONHALA MAGNAIR is an important part of that.
Individual results may vary. Consult your healthcare provider to see if LONHALA MAGNAIR is appropriate for you. Summary of important information for LONHALA MAGNAIR glycopyrrolate inhalation solution.
This summary does not include all information about LONHALA MAGNAIR and is not meant to take the place of discussions with your healthcare provider about your treatment. Please read this important information carefully before you start taking LONHALA MAGNAIR. Discuss any questions about LONHALA MAGNAIR with your healthcare provider. What is LONHALA MAGNAIR? LONHALA MAGNAIR is a prescription anticholinergic medicine used long-term and twice each day, morning and evening, to improve symptoms of chronic obstructive pulmonary disease, COPD, in adults with COPD. COPD is a long-term chronic lung disease that includes chronic bronchitis, emphysema, or both. Anticholinergic medicines, such as LONHALA MAGNAIR, help the muscles around the airways in your lungs stay relaxed to help control COPD symptoms such as wheezing, coughing, chest tightness, and shortness of breath. Who should not use LONHALA MAGNAIR? Do not use LONHALA MAGNAIR if you have sudden symptoms of COPD. LONHALA MAGNAIR should not be used as rescue therapy. Always have a short-acting beta-2 agonist medicine, rescue inhaler, with you to treat sudden symptoms of COPD. If you do not have a rescue inhaler, contact your healthcare provider to have one prescribed, are allergic to glycopyrrolate or any of the ingredients in LONHALA MAGNAIR. See below. Ask your healthcare provider if you are not sure. Active ingredient, glycopyrrolate. Inactive ingredients, citric acid monohydrate, sodium chloride, sodium hydroxide, and water for injection. LONHALA MAGNAIR should not be used by children. It is not known if LONHALA MAGNAIR is safe and effective for children. What warnings should I know about LONHALA MAGNAIR? LONHALA MAGNAIR can cause serious side effects, including sudden shortness of breath immediately after use. Sudden shortness of breath may be life-threatening. If you have sudden breathing problems immediately after inhaling your medicine, stop using LONHALA MAGNAIR. Call your healthcare provider or go to the nearest hospital emergency room right away. Life-threatening paradoxical bronchospasm, which means your airway passages may narrow and breathing may become difficult. Stop using LONHALA MAGNAIR immediately. Serious allergic reactions. Stop using LONHALA MAGNAIR if you get any of the following symptoms: rash, swelling of the tongue, lips, and face, hives, difficulty breathing or swallowing, new or worsened eye problems, including acute narrow-angle glaucoma. Acute narrow-angle glaucoma can cause permanent loss of vision if not treated. Symptoms may include eye pain or discomfort, blurred vision, nausea or vomiting, red eyes, seeing halos or bright colors around lights. New or worsened problems emptying your bladder, urinary retention. People who use LONHALA MAGNAIR may develop new or worsened urinary retention. Urinary retention can be caused by a blockage in your bladder, or it can develop in men with a larger than normal prostate. Symptoms may include difficulty urinating, urinating frequently, painful urination, urination in a weak stream or drips. If you have any of these side effects, stop using LONHALA MAGNAIR and call your healthcare provider or get emergency medical treatment right away before taking another dose. Do not exceed the recommended dose. Excessive use of LONHALA MAGNAIR or use with other anticholinergic medications can result in undesirable increase in anticholinergic activity. If your COPD symptoms worsen over time, do not increase your dose of LONHALA MAGNAIR. Call your healthcare provider. What should I tell my healthcare provider before using LONHALA MAGNAIR? Before using LONHALA MAGNAIR, tell your healthcare provider about all of your medical conditions, including if you have kidney problems, have eye problems such as glaucoma, LONHALA MAGNAIR may make glaucoma worse. Have prostate or bladder problems, or problems passing urine. LONHALA MAGNAIR may make these problems worse. Are pregnant or plan to become pregnant. It is not known if LONHALA MAGNAIR can harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if the medicine in LONHALA MAGNAIR passes into your breast milk or if it can harm your baby. Are allergic to LONHALA MAGNAIR or any of its ingredients or any other medicines. Tell your healthcare provider about all the medicines you take, including prescription medicines and over-the-counter medicines, vitamins, and herbal supplements. LONHALA MAGNAIR may affect the way other medicines work, and other medicines can affect how LONHALA MAGNAIR works. This may cause serious side effects. Especially tell your healthcare provider if you take other anticholinergics, including umeclidinium, tiotropium, ipratropium, aclidinium, glycopyrrolate. Know the medicines you take. Keep a list of your medicines with you and show it to your healthcare provider and pharmacist when you get a new medicine. How should I use LONHALA MAGNAIR? Read the step-by-step instructions for using LONHALA MAGNAIR found in the prescribing information and the manufacturer's instruction for use booklet. Only use LONHALA vials with the MAGNAIR device. Do not use LONHALA MAGNAIR unless your healthcare provider has taught you how to use the device and you understand how to use it correctly. Use LONHALA MAGNAIR exactly as your healthcare provider tells you to use it. Do not use LONHALA MAGNAIR more often than prescribed, at higher dose than prescribed, with other anticholinergic medicines. Inhale the medicine in one LONHALA vial through the MAGNAIR device twice each day, one vial in the morning and one vial in the evening. Do not inject or swallow the LONHALA medicine. If you miss a dose of LONHALA MAGNAIR, just skip that dose. Take the next dose at your usual time. Do not use 2 vials at one time. Do not use more than 2 vials in a day. Do not stop using LONHALA MAGNAIR or other medicines to control or treat your COPD unless told to do so by your healthcare provider. Your symptoms might get worse. Your healthcare provider will change your medicines as needed. What are the possible side effects with LONHALA MAGNAIR? See what warnings should I know about LONHALA MAGNAIR. Common side effects of LONHALA MAGNAIR include shortness of breath and urinary tract infections. These are not all the side effects of LONHALA MAGNAIR. Tell your healthcare provider about any side effect that bothers you or that does not go away. Ask your healthcare provider or pharmacist for more information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. This information is not comprehensive. How to get more information? Talk to your healthcare provider or pharmacist. Visit www.lonhalamagnair.com to obtain the FDA-approved product labeling. Call Sanovian at 1-888-394-7377.